Hello friends, welcome back to my channel. In this video, I am going to tell about axillary artery and its branches. Axillary artery is the one which arises from the subclavian artery. So axillary artery means it is a continuation of subclavian artery and it terminates as brachial artery. The extent of axillary artery is from outer border of the first rib. Here, this is the outer border of this is the first rib. So it continues from outer border of the first rib and ends at the lower border of teres major muscle. Extent of axillary artery is from outer border of the first rib to lower border of teres major muscle. So this axillary artery it is divided into three parts by pectoralis minor muscle. So this is the axillary artery. This axillary artery it is divided into three parts by pectoralis minor muscle. This is the pectoralis minor divides the axillary artery into first part, second and the third part. First part which lies proximal to the pectoralis minor, second part which lies behind the pectoralis minor and the third part which lies distal to the pectoralis minor. Now coming to the relations of axillary artery. This is the first part. First part of the axillary artery. It has anterior relation, posterior relation, medial and lateral relation. Anterior relations of axillary artery are the skin, superficial fascia, pectoralis major, clavipectoral fascia, and then loop of communication between the lateral and medial pectoral nerve, and it is crossed by the cephalic vein. And coming to the medial relation, it is related medially to axillary vein. And laterally it is related to lateral cord of brachial plexus and posterior cord of brachial plexus. Behind it is related to first and second digitation of serratus anterior, long thoracic nerve and the medial cord of brachial plexus. Here in the picture the cord relations only it is given in the axillary artery. Now coming to the second part of axillary artery and its relation. So this is the pectoralis minor muscle. Deep to that it is considered as the second part of the axillary artery. So this second part it is anteriorly it is related to the skin, superficial fascia, pectoralis major muscle. Here in the picture you can see only the cut end of the pectoralis major, pectoralis minor. In between that the clavipectoral fascia. This comes under the anterior relation. Medial it is related to medial cord of brachial plexus and axillary vein. Lateral it is related to lateral cord of brachial plexus. Posterior it is related to posterior cord of brachial plexus. So these are the relations in the second part of the axillary artery. Now the third part of the axillary artery and its relation. Anteriorly it is related to pectoralis major muscle in the upper part, and here it is the axillary artery, the third part of axillary artery. Anteriorly it is crossed by the medial root of the median nerve. Behind posterior it is related to subscapularis muscle, teres major, latissimus dorsi, axillary nerve and radial nerve which is from the posterior cord of brachial plexus. Medial it is related to axillary vein, medial cutaneous nerve of arm, medial cutaneous nerve of forearm and ulnar nerve. Lateral it is related to lateral root of median nerve, coracobrachialis and musculocutaneous nerve. Now coming to the branches of axillary artery. From the first part, superior thoracic artery arises. From the first part, one artery arises. From the second part, two arteries are arising. And from the third part, three arteries are arising. First, we'll see the first part. It is the artery arising from the first part is superior thoracic artery. So this arises from the upper border of the pectoralis minor muscle, and this supplies anastomose with the internal thoracic artery. Now coming to the second part, thoracoacromial artery and lateral thoracic artery are arises from the second part. So thoracoacromial artery which pierces the clavipectoral fascia, and this is divides into four branches, each branch which are right angle to each other. So four branches which are arising from the thoracoacromial artery, which are clavicular branch, pectoral branch, acromial branch and deltoid branch. So clavicular branch which run along the medial side of the clavicular part and supplies to the sternoclavicular joint and the subclavius muscle too. And another one which is pectoral branch which pierces the pectoralis minor and pectoralis major and supplies these muscles. And acromial branch which runs deep to the deltoid and when crosses the tip of the coracoid process and it anastomoses with the neighboring branch around the acromial artery. The next one is deltoid branch. This passes deep to this deltoid and enters along with the deltopectoral groove along with the cephalic vein and supplies to the deltoid muscle. Next one is lateral thoracic artery. This runs along the lower border. So here is the lower border of the pectoralis minor muscle. This runs along the lower border of the pectoralis minor, and this gives a large branch which supplies to the mammillary gland. Lateral mammillary branch which supplies to the mammary gland of breast. The next one is from the third part, three branches are arising. Anterior circumflex humeral artery, posterior circumflex humeral artery and subscapular artery. Anterior circumflex humeral artery which runs along the anterior aspect of this surgical neck of the humerus, and this will get anastomosed with the posterior circumflex artery which crosses the quadrangular space of the axilla. Along with the posterior circumflex humeral artery, axillary nerve also accompanying in that. This anastomoses with the anterior circumflex artery and this giving a descending branch. See, this posterior circumflex is giving a descending branch and this will get anastomosed with the profunda brachii artery. Then coming to the subscapular artery, which is the largest branch of the axillary artery, and this giving a circumflex scapular artery which runs along the up triangular space of the axilla. So these are the branches which are arising and supplies to the neighboring muscles and the region from axillary artery. Thank you friends. Thank you for watching this video. If you like this video, please share and subscribe and don't forget to click the bell icon.